I'm happy to be here today to talk about the BC people living with HIV Stigma Index. I'm Paul, and
as was said, my name is Madeline, or for some folks in the room, MP.
Great. And we'll be presenting today on some findings from the BC people living with HIV Stigma Index. We'd like to acknowledge and express our thanks to the study team, which is who led this project, and the PRAs who supported the data collection, and their names are up there. One that we did omit and I'll mention is Jana's study. So, a bit of a background about the Pacific AIDS Network, often referred to as PAN. PAN is a provincial organization with over 40 members. Some of our work includes capacity building, leadership, community-based research and evaluation, and advocacy and collective action. And some background on the people living with HIV Stigma Index. It's international. And over 100 countries have used the index since 2008. It was designed for, by and for people living with HIV. And there are several regional teams working with the Stigma Index across Canada. BC was the first, we were the first to use it in Canada, so we were kind of the leaders. It's been now rolled out into Ontario, has just completed theirs, to Quebec, and it's moving into some other provinces. The BC people living with HIV Stigma Index is PAN member community recognized that the HIV stigma is an ongoing issue and asked for research, so it's peer-driven. We had a steering committee, peer research associates. They helped with the analysis and with the knowledge translation.
So before we get into the findings, I wanted to talk a little bit about some of the limitations of this study. So the first is that this is not a representative sample. We can only speak to participants in our sample, so these findings are not generalizable. Second off, recruitment was primarily carried out through AIDS service organizations, community-based organizations, and some clinics. We had small sample sizes from some health authorities. The people living with HIV Stigma Index is primarily a quantitative tool, but in this study acts somewhat like case study data. Finally, we would like to note that the people living with HIV Stigma Index is a standardized international tool, and so because of this, we couldn't take questions out of the tool. We could only add new ones. So in terms of findings, the BC people living with HIV Stigma Index had 176 participants overall. 72 participants identified as gay, bisexual, or men who have sex with men, or gbMSM. Participants in the study were asked how long they had been living with HIV. Out of all the participants, 28% said 0 to 4 years, 22% for 5 to 9 years, 34% for 10 to 14 years, and 16% for 15 or more years. Focusing on participants in the study who identified as gbMSM, 51% of gbMSM participants had been living with HIV for less than 10 years, and 49% for 10 or more years. 49% of gbMSM participants lived in the Vancouver Coastal Health region, while 51% lived outside of Vancouver Coastal.
So, what did we learn? The next 3 slides refer to gbMSM participants in our sample. So, many of the study participants had developed strengths and resilience over time. As you can see, 70% of gbMSM participants in the study said their response to stigma and discrimination had gotten better over time. And 59% said that their experience of stigma had also gotten better over time. Another thing that we learned is that in some instances, our gbMSM participants reported avoiding healthcare for less than non-gbMSM participants. For example, only 14% of gbMSM participants reported skipping a dose of medication as a result of stigma and discrimination, compared with 41% of non-gbMSM participants. We also looked a bit at gbMSM participants in our sample stratified by how long they had been living with HIV, and found that in some instances, a higher percentage of this sample who had been living with HIV for more than 10 years, for example, 22% of gbMSM in our sample who had been living with HIV for less than 10 years reported avoiding healthcare, compared to 14% in our sample who had been living with HIV for 10 years or more.
We've also started to look more at intersectionality of stigma. As you can see, participants were asked if they had experienced stigma and/or discrimination for reasons other than their HIV status, and were asked to select one category that best explained why they felt they were stigmatized or discriminated against. There is a limitation in this, in that participants were only permitted to select one other reason from a pre-existing list, so this doesn't truly speak to intersectionality, but does provide a starting place for doing more work around this. Here are some of the other reasons for stigma and discrimination that were selected by gbMSM participants in our sample. The study's participants also had some opportunities to share about their stories and experiences. Here are some reflections and experiences on challenges and barriers from participants in our sample who identify as gbMSM. Likewise, here are some reflections and positive experiences reported from our participants in our sample who identify as gbMSM. Give folks a chance to read the slide.
Great. And a little bit about the next steps for the BC people living with HIV Stigma Index. We'll be doing a further analysis and knowledge translation, moving towards stigma reduction, intervention planning, and looking to explore more common evaluation mechanisms and tools for stigma reduction and intervention. In closing, we'd like to thank you for giving us the opportunity to present the project, as well as acknowledge the BC people living with HIV Stigma Index is a team effort and engages the whole team. We'd like to, again, also acknowledge, of course, our funders.
And I just have one more quick slide at the end. This is a quick opportunity for folks to check out some of the other resources that have come out of this project, which are available on the PAN site. Thank you again for having us.
Thank you.